Good morning, good afternoon, or good evening, depending on where you are joining us from. I'm Dr. Razan Al-Arafa, Global Health Policy Analyst at the G20 Global Innovation Hub for Improving Value in Health. It's truly a pleasure to welcome you all to today's webinar, Drivers and Barriers of the Implementation of Value-Based Healthcare in Latin America. At the Global Innovation Hub, we work to advance value-based healthcare globally, a model that redefines how we measure success in health system, not by the number of services delivered, but by the value created for patients and societies. Today's session is particularly meaningful as it builds on a year of collaboration with Brazilian G20 presidency, the University of Miami, and the US Chamber of Commerce, where together we examined how countries in Latin America are transforming their health system to achieve better outcomes for every dollar invested. This report, which we will discuss today, is one of our flagship knowledge products, and it provides evidence, policy insights, and comparative lessons from Brazil, Mexico, and Argentina, identifying both the barriers and the opportunities to implement value-based healthcare in complex and evolving health system. Personally, I'm honored to be part of this journey, from contributing to the development of dissemination of this research to now facilitating a conversation among some of the most respected leaders driving value-based healthcare transformation globally. Let me briefly introduce our distinguished speakers. Bnayan, Executive Director of the G20 Global Innovation Hub, and a recognized leader in value-based healthcare, whose work has shaped the policy dialogue around global health system resilience and value. Welcome, Dr. Reem. Dr. Michael Touchton, Associate Professor at the University of Miami, the lead author of the report we are discussing today. His research on political economy of health and governance has provided invaluable comparative evidence across Latin America. And lastly, Ms. Catherine Robinson, Senior Director of the Global Trade Policy and International Government Affairs at Pfizer, who brings an essential private sector perspective on how innovation partnership and financing mechanisms can enable the shift toward value-based healthcare. I would like to apologize for Dr. Éctor. He will not be joining us today. Throughout this session, we will explore how value-based healthcare is evolving across Latin America, what workings, what's holding system back, and most importantly, how countries can collaborate to scale solutions that strengthening equity and sustainability. With that, it's my honor to invite Dr. Reem Bnayan to deliver her opening remarks. Dr. Reem, the floor is yours.
Thank you, Dr. Razan, and I'm truly delighted to be with you today. Thanks, Razan, for setting the stage for the conversation that we're having. And in my remarks, I'd like to begin by briefly reintroducing the organization that I represent, which is the Global Innovation Hub for Improving Value in Health. The hub was established under the Saudi G20 presidency in 2020 as an organization that is an accelerator to global transition towards better value in health and care, an approach that seeks to achieve the best possible health outcomes at sustainable cost. Since our establishment, the hub has served as a global platform for knowledge exchange, collaboration, and policy innovation, connecting countries, international organizations, academia, thought leaders, and the private sector. Our mission is clear: to improve value in health and care by supporting policymakers with evidence-based insights, data-driven tools, and models that can be adapted, transferred across different contexts. We do this by producing knowledge products, facilitating cross-country learning, and supporting implementation pilots that translate policy into measurable impact. But let me also stress something. We often emphasize that innovation is not only technological. A true innovation is systemic. It lies in redesign of models, whether they're payment models or care models or policies in health settings. Innovation is about building systems that are equitable, resilient, and sustainable. This is why today's conversation is very timely. The report we're presenting today is the second regional global study that we've done. The first one addressed the MENA region, and this one is addressing Latin America. The work was done by our colleagues at the University of Miami, and so delighted to have you with us, Michael, today. And it represents an important milestone in this journey. It offers a comprehensive analysis of the drivers and barriers for implementing value-based healthcare in Brazil, Mexico, and Argentina, highlighting where progress is made and where critical challenges remain. With this, I look forward to the conversation and hand over back to you, Razan.
Thank you, Dr. Reem, for your opening remarks. And now we'll get more in depth about the discussion of the report, which will be presented by Dr. Michael Touchton. Please, the floor is yours.
Thank you very much. Thank you both for the kind introductions and for your generous support over the course of this project. I think our working partnership has been excellent, and I'm pleased to discuss some of the results of the research for this audience and hope to do more with the Global Innovation Hub in the future. Let me share my screen now. And well, first I'd like to thank my co-authors, Héctor Arreola Ornelas from the Tec de Monterrey, and Dr. Felicia Knoll, who's now at UCLA, formerly University of Miami. We started this project with support from the Global Innovation Hub, as well as the U.S. Chamber of Commerce and several private sector health companies that all, including us as policy analysts and researchers, have a vested interest in improving value across health systems in Latin America and beyond. Long-term health outcomes instead of short-term costs or volumes are essential in terms of a focus to improve performance, not just in the health system, but health for individuals and groups across the Americas. And as Dr. Reem mentioned, this study is in many ways a landscaping, early scoping effort to evaluate how 3 countries in the G20, in this case Argentina, Brazil, and Mexico, have progressed, or in many cases not progressed, towards incorporating value-based principles in their health systems. Of course, globally, the Innovation Hub and many observers understand that there are common challenges across international systems. Costs are rising everywhere. Variation in care quality and experiences is also growing and in some cases becoming quite volatile. These variations are often exacerbated in fragmented, decentralized health systems like those that we often see in the Americas, particularly for the larger, the physically larger and more populous countries which use federal systems of government. We see a growing burden of disease, and that's coupled with an epidemiological transition towards more chronic conditions, but longer life, though that life is of poorer quality oftentimes because of this disease burden. So moving away from acute considerations to chronic considerations puts a strain on finances and can result in inequality across individuals, like based on class, but also across geographic space in terms of capabilities of health systems. Simultaneously, we see a lot of waste in resources and equipment that in some cases drives higher costs that are passed on to the patient, and rising healthcare errors or safety issues. The culmination in many cases is lack of access to healthcare, and instead of progress towards universal health coverage, we get a decline in access, a decline in quality, coupled with rising costs and rising inequality, which all makes for an unsustainable combination. Value-based healthcare as a set of principles, I think, can work to improve health outcomes while optimizing health systems and reducing costs, at least in principle. That's the idea. It can do this, and I hope as attendees and viewers, you're familiar with some of these value-based healthcare arguments and principles and the logic behind them. But there are a few different goals and quite a few avenues to achieve those goals. But in a general sense, these arguments are designed to improve patient outcomes, overall patient satisfaction, quality of care, while reducing expenditures, leveraging efficiency gains, and superior resource allocation, and then also providing an ecosystem for innovation and leveraging, again, the expertise in the private sector, the nonprofit sector, and public sectors to create partnerships that then foster the creation of value. And through these multi-sectoral, multifaceted, team-based activities and reforms, hopefully we'll achieve these common goals to improve healthcare across all sectors. This is especially relevant, we think, in the Americas, where health systems tend to be fragmented relative to unitary service provision in a health system like through National Health Service in the UK. You see a wide variety of patient access, financing mechanisms, quality of care, service providers, and generally speaking, a difficult landscape to understand in some ways just at a fundamental level, but then also it represents a considerable challenge to improving outcomes because of this fragmentation. That being said, it also provides a lot of opportunities where we might see intransigence or unwillingness to incorporate any value-based principles in one portion of the health system, but that allows for advancement in other areas. The goal, as I mentioned before, is to examine these drivers, barriers, and unique opportunities to deliver value across the G20 member countries, the larger ones in these cases in the Americas, largest, most populous countries after the United States and Canada here. And we focused on both national level and regional level questions. We wanted to map the policies in place to support the rollout of value-based healthcare, just assess the pure existence or lack thereof of institutions or teams in each country, and consider the unique aspects of Latin American health systems for opportunities to introduce value-based healthcare, as well as key areas of innovation within each system. It is important to note that these three systems have had a lot of volatility themselves in the last 5 to 10 years, a lot of upheaval, considerable reform and opportunities, some advancements, some backsliding, and some crises. Of course, the pandemic created challenges for all three countries, but we also see large swings in political will to reform, as well as goals surrounding those political reforms in each case. in some cases, abandonment of previous systems and installation of new systems. In others, maintenance of systems, but in some cases, defunding those systems. In others, a need because of financial crises, in this case of Argentina, to implement reforms that can incorporate value. And so in each case, we have different health systems. Brazil's is probably most unitary, but most people, if they can afford it, rely on private sector care. So it ends up in practice being fairly fragmented, though there is a large, relatively unitary health system. Again, though, it's operated through the states and through municipalities. So in practice, you could have 5,570 different municipal service providers in some way, shape, or form, depending on how you think of it, as well as differences across states. In Argentina and Mexico, you have mixes of public, private, social security plans. Mexico under AMLO had or has seen an effort that continues under President Sheinbaum to centralize and avoid fragmentation in the health system. But that new system has a long way to go before it achieves the quality of care that Mexico had already achieved under Seguro Popular before the pandemic and before its dismantling. So these health systems are in flux, and I think in some ways more vulnerable than they were a decade ago, but possibly more open for innovation and integration of value-based principles as well. We took a point of departure from a Harvard study of high-value health systems from just a few years ago that identified 10 components, and we set out to assess the degree to which each country, Argentina, Brazil, and Mexico, in the national health systems, as well as in private sector service delivery, had made any progress, or in some cases had slid backwards in pursuit of these 10 components. And you can see them on the screen. I don't need to read them off, but that's where we started. And here are the rankings per country. We divided those 10 components into domains, created indicators for each of the domains, and then used a series of interviews with policy experts, policymakers themselves, academics, and our own desk research through a wide variety of sources of literature and evidence to determine a ranking on a 1 to 3 scale, or 0 to 3, I should say. Red is bad in this case. We used a traffic light metaphor here. Green is good, or go, as positive, and the yellow is in between. But all you need to know from this slide is how much red appears on the screen, which is to say that in most of these high-value health system domains, for most indicators, these 3 countries are at a very early stage in pursuing value-based principles within their health systems and incorporating those principles as well. In a few areas, you see some activity. A lot of that activity has been very recent. In most areas, you see the beginnings of a conversation, especially in the public sector. The private sector in all 3 countries, I think it's fair to say, has moved farther and faster, and faces different incentives and different resources, and in some ways has different goals, sometimes based on politics or ideology, than what we see in the public sector. But you don't see a lot of movement anywhere until fairly recently, and that movement that we see is partial at best and very clearly incomplete, although there is some movement and some progress. Next, we evaluated these three countries in terms of the receptivity of the context and the positioning of an innovation ecosystem. And here we see better results in the sense of an appetite for more value-based incorporation into the health system, or principles of value being incorporated into the health system. From a political, economic, technological, epidemiological, legal standpoint, from the perspective of possibilities of governance and financing, available capacity from a workforce standpoint. So more appetite than before, and a sense of urgency that I don't think existed before the pandemic, certainly, and might not have existed before these major changes in the health systems, before big swings as well in terms of volatility between different presidents with different priorities in each country, and concern for long-term sustainability and just viability within the health system. And so we rate these countries more optimistically, I guess, from the standpoint of being ready for the next step, rather than having taken those next steps, which they, in most cases, have not done. But there is, I think, in some cases, these are health ministers, current health ministers, who will say, we need to incorporate these principles. We have a plan to do it, but very rarely have they done it in that sense of incorporating value into the 10 domains we outlined. So we see some benefits and some detractions of those actions. There has been more attention to value in all three countries. There's been progress in digital data and analytics in all three cases. An effort to measure costs and outcomes is also present in most of these countries, but it's also important to note that there are regional variations. In Mexico in particular, some states have moved farther, faster. They have a lot of discretion in terms of their position within the public health system and service delivery, as well as discretion in terms of how much to partner with the private sector, how willing they are to do that. Brazil has some of this too. So you see a patchwork, a quilt, if you examine the progress subnationally, such that you see some evidence of advances in some areas, and that's a very positive development. But in no country do we see advances in all areas, and those advances that we do see are somewhat limited. So there are reasons to be optimistic, and then also reasons to be pessimistic or skeptical about progress. In terms of remaining challenges, we see problems based on fragmentation and based on decentralization for data integration. We also see problems integrating across public, private, and nonprofit sectors from a service provision standpoint. If one group advances from a data and analytics standpoint, they have to be able to speak with and exchange data with other groups to improve comprehensive cost and outcome measurement. And that's been challenging and has not developed as much as we would like to have seen. Similarly, governments in many cases are stuck in a fee-for-service model. Value-based reimbursement based on performance has been advancing in some areas, again, subnationally, in some portions of the private sector as well, but fee-for-service is still the norm, and it still causes problems from a value standpoint. low-cost procurement is similarly entrenched, and through lobbying, through contracting and bidding requirements within mostly national health systems, but also state and local public systems, there's a great difficulty in transitioning from the lowest cost bid to the highest value bid, and to focus on a value-based payment model, which has been difficult. And finally, with the considerable volatility from a policy and ideology standpoint in government in all three countries over the last decade, we see rapid changes in buy-in, where the incoming group wants to tear down and generally not rebuild, but replace the previous government's health system or programs with something else. And top-level commitment over time is essential for a longer-term transition towards value. And regardless of the quality of the ideas of governments, health ministers, policymakers, as they enter office, we don't have that long-term top-level commitment that's consistent across administrations. And that's difficult. We end the report with a variety of recommendations that are easier to recommend than to implement, but we do need a comprehensive approach that includes not just the policy reforms I was mentioning, but also major investment in infrastructure and stakeholder collaboration. As it stands now, a lot of financial incentives are misaligned. Data infrastructure, especially across sectors and levels of government, isn't present. Reforming payment and procurement models has been difficult, even when the policymakers agree with the basic concept and need for reform, and the arguments that would empower and engage patients, they still find it difficult to implement and to pass new legislation that, for example, moves from a fee-for-service model to a different form of outcome-based reimbursement, or the procurement system. Reforming an entire federal procurement system, even just within the health system, is tremendously difficult. And it's necessary, but we understand that the political will and capacity to do such major reforms is hard to come by. There are regional opportunities for collaboration, but some of these opportunities are perhaps less applicable now than when we wrote the report, in terms of access to funds and possibilities for regional collaboration among the public sector, at least. The private sector opportunities are still present and probably growing. We see the need for these resilient health systems based on value, and that's a positive. People understand that reforms are necessary, but national health systems reforms are not enough. So this is challenging because of the decentralized nature of government in all three countries, but also the Americas, broadly speaking. State and municipal governments have to be involved. The private sector has to be involved. And without that, these reforms, if they exist at all, aren't going to go anywhere. So with that, I see a lot of possibilities. I want to thank my co-authors and sponsors of the study. And then I think I can pass this back to Razan.
Yeah. Thank you, Dr. Touchton, for those insightful findings and policy implications, especially your comparative lens across Brazil and Mexico and Argentina. So to hear how these insights resonate at the country level to complete this rich set of perspective, we will now turn to the private sector. I'm pleased to welcome Catherine Robinson from Pfizer, who will highlight the role of partnership, innovation, and financing models in supporting this transition. Catherine, the floor is yours.
Great. Thank you so much. Appreciative of the invitation to join today's discussion. It's an honor to be here and to share some insights on this important topic. I'll try not to repeat what has previously been mentioned, but I think it's just really important that there is such a focus on creating resilient healthcare systems and addressing inequities that exist. And one of the keys to making that a reality is really this transition to value-based healthcare. And so while the concept of value-based healthcare is advancing across Latin America, and in particular the three markets highlighted in the study, it's really important that we really are at the very early stages, and that hopefully by all working together and really getting the perspective of all people that are a part of this ecosystem, patients, healthcare providers, administrators, policymakers, private sector, NGOs, that we can all really come together to make this substantial shift in the way that we approach providing healthcare. Because really that shifting to value-based is going to be the key to successfully providing healthcare across country, subnational, national, and then regional and global healthcare systems. Why should we shift to value-based healthcare? I mean, one, value-based systems offer substantial return on investment. These investments in health actually are critical for creating sustainable growth. At a microeconomic level, using value-based systems really help address many of the sustainable development goals, such as increasing life expectancy, improving quality of life, building human capital, and enhancing labor productivity. At the mid-macro level, it addresses many of the equity issues that we are dealing with, not only in health, but around our communities as a whole. So it helps address or reduce the health gap by race, gender, and economic status, helping to really create that greater level of socioeconomic stability, because the greater health you have, the greater wealth and greater economic participation you're able to do. And then at the full-on macro level, again, building on my previous comments, there are substantial economic impacts and positive effects that come from growing national GDP, to being able to drive innovation, build infrastructure, and increase overall contributions to the economy. And so these large issues are why trying to shift from a cost-only system to value-based healthcare is really, really critical. Governments often see health as a cost, and they don't see it as an investment in your population and your economy. And so how do we shift that mentality? How do we change the way that we think about it? Because if you look at the research, you really can see that direct correlation between economic development and health spending. So the more you spend on health, the more that comes back to your government. And then the less you spend on health, the more negative impact it has actually on your GDP. So we really need to think about these larger macroeconomic issues. According to a McKinsey study from a few years ago, for every dollar that a government invests in improving health, 2 to 4 on that investment. But the challenge that we face in implementing value-based healthcare is that governments or subnational governments operate with annual budgets. And so that return on investment, the use of value-based healthcare, isn't seen immediately. So you can't put it into a spreadsheet to have for your annual budgets. It's going to be years down that you see that impact. So how do we have that conversation? How do we engage with governments so that we can use value-based healthcare when it doesn't necessarily fit with the way that annual budgets are modeled and operate? I think that is really the fundamental challenge that everyone is struggling with: industry, governments, health organizations, because I think the benefits speak for themselves, but the implementation is much harder. So from the private sector's perspective, we really are trying to do a better job at how can we measure the economic and societal impact of access to innovation, and get that information to policymakers to help these conversations advance. And we're doing that in two ways. We're doing it, one, collectively, and then we also do it individually as companies. From a collective perspective, in the Americas, 3 years ago, we launched a new public-private platform and partnership called America's Rise for Health, which the whole goal was to bring together industry, NGOs, government, and other key stakeholders to really talk about how do we work together to advance health in the Americas. And this really came out of the idea that health and economic prosperity are intrinsically linked, and that oftentimes they're talked about in silos, so that if we can bring ministers of health, ministers of finance, ministers of trade and economy together with the different stakeholders to have these holistic conversations, hopefully we can advance innovative financing and value-based healthcare systems in the America. And so as part of the America's Rise initiative, there are 5 workstream pillars, and one is on health finance, and another is on trade. And under those 2 pillars, there's a lot of work that's being done on value-based healthcare and innovative financing mechanisms, so that we can collectively talk about why governments, why these type of policies are actually going to help governments achieve their health and economic goals, and then 2, what are the barriers and challenges that currently exist, and how can we overcome them by working together to advance these concepts. So at the last RISE meeting in 2024, all parties agreed to a multi-phase strategy to promote innovative health financing mechanisms, and also to implement value-based healthcare and procurement capacity building training across the Americas. So those are 2 examples that really highlight the ways that we are trying to collectively work together across the ecosystem in the region to advance these concepts that were previously mentioned by the other speakers. And then I mentioned individually, companies are also working to advance value-based systems. And so individually as a company, we're trying to do it in 3 kind of broad ways. One, how can we work with governments on financial-based agreements that help governments manage the financial uncertainty in the procurement of medicine? So we work with the governments to sit down and understand what is possible within their budgets. The second area is performance-based agreements, which really help manage clinical uncertainty. So not all medicines have the same effect on all patients. For some patients, a certain medicine might be just exactly what they need. It will have the clinical benefits necessary to address their illness, and it will then make them a healthy, productive member of society. Another patient could take the same medicine, but they may not have the same impact just because of the way that their own body metabolizes and tolerates the medicine. So with these performance-based agreements, you're able to work with governments to cover the risk that if you procure the medicine, we will come up with some sort of arrangement where for those patients where the medicine is not effective, then you will be reimbursed for the cost of the medicine. And so that requires working with the governments to see if they have authority to do those type of agreements, to make sure they have the proper surveillance and pharmacovigilance systems in place to be able then to track the impact across the patients. But that is one area. And then another area that we work with governments on in order to come up with innovative ways to really help implement value-based systems is working what we call with coverage with evidence development, so that you are able to introduce the medicine fast into a population, and then over time, based on the actual use and outcomes of that medicine, then you can make different decisions on how you reimburse and how you provide access based on the impact to the population. And so this allows for a lot more flexibility and creativity, so that you're able to get new innovations into a population faster, as opposed to relying on older medicines. So those are really, we're really trying to approach this from both an industry-wide, working with policymakers and NGOs to really help shift just the idea from cost to value, because that's where we're going to see the most significant impacts that are going to help align with patient needs and economic productivity. But as has been previously said, a lot is being done, and there has been a lot of agreements to do these different innovative financing agreements, largely on the subnational level, because in many of the countries that were a part of the study and across the region, they don't have the legislative, legal, or regulatory authority to actually do these type of agreements. So that's also an area that we're working with governments on, is to make sure that they have the frameworks that are needed to allow for the implementation of value-based healthcare across the region. But maybe I'll stop there, because I think I've said a lot fast, and look forward to the conversation.
Thank you, Catherine, for your insightful perspective representing the voice of private industry. Private-public partnership is important to improve value-based healthcare. And let's now open the floor for our Q&A session. Please, you can post your questions in the chat, and you can also address it to a specific speakers if you would like. Let me start with just one guiding questions to spark the discussion until we get the questions from the audience. So I would ask Dr. Touchton, based on your comparative research, which governance features decentralized have proven most effective in enabling sustainable value-based healthcare reforms, and how might other countries replicate them?
Excellent, thank you. And let me echo the points that we just heard, representing the private sector, but not just the private sector. The idea here is to align incentives and to shift thinking from the top to the bottom and back up again and everywhere in the middle across sectors, levels of government, and even individuals. And so I think in part where decentralized reforms have been most successful is where political partisanship has been taken out of the equation, where health is an investment for all. Everybody can get on board with wanting healthy communities and wanting prosperous communities. That's not a left, right, or centrist issue. It should not be controversial. And where you see a lot of advancement in a decentralized space is in some cases down to the municipal level, where you don't have partisan-based elections for mayor, for example, or town council, but you do have discretion surrounding innovative programs in health and policies, and some resources to implement them, usually coming from the federal level. When regional authorities and health providers share responsibility for outcomes and resource allocation, also with some transparent performance metrics, you see a big benefit. And creating spaces for patient feedback, for citizen and provider input, but also to decentralize decision-making within some clear national framework. So I'll give you an example here that's well, it's uneven, but I think applicable. Brazil's health system is large, relatively well-funded from a historic standpoint, relatively high capacity from a historic standpoint, but it operates from the federal level, passes through budgets to the states, and then down to the municipalities where service delivery often occurs. There are also state hospitals and, as I mentioned before, a big private sector. In many municipalities, there are policy management councils. Almost all of them have something called a health policy management council, and it incorporates multi-sectoral participation and decision-making, representatives from communities, like a delegate kind of model, but also private sector, expert-based, public official presence on these local decision-making bodies that have veto power over the local health budget and therefore its policies. The budget component is key, and if you can bring more voices into a budget process that results in, I think, not just more reasonable, but a different theoretical orientation toward value and away from costs in favor of outcomes, you can get away from some of these basic annual budget cycle problems that we heard about, and also basic, what we call the political business cycle in political science terms, where people are elected for short terms. The payoff for investment in health is long term. And the politicians want to gain the votes by satisfying people in the shorter term. And if Dr. Éctor couldn't make it today, but he's a member of the Federal Chamber of Deputies in Mexico. They have 3-year terms. It's similar to the House of Representatives in the United States with 2-year terms, which means your electoral payoff has to occur within that time frame. And the investments in health aren't going to pay off in such a short time frame, at least not the economic multiplier effects. The short-term benefit to individuals' health will happen relatively quickly, but these knock-on benefits that are so important for healthy economies and long-term sustainability of this kind of shift in thinking towards value, that doesn't happen overnight. And so if you can incorporate more voices into a longer-term budget cycle and get away from partisan politics, you have a better chance of improving these outcomes and making a shift towards value. Again, that's just a partial example, but I think important things to consider based on the question. Thank you.
Thank you, Dr. Michael. I will just take one more question from
you're
our
on mute,
participants.
Razan. Or I can't hear you anyway.
Can you hear me now? Okay, so I will now take this question's for you, Catherine. So from an industry standpoint, what policy or partnership mechanisms are most critical to align private sector innovation with national value-based goals while ensuring equity and affordability?
Yeah, it's a great question, and there's not really a one-size-fits-all answer to that question. I mean, I think if you take the area of procurement specifically, one policy that most governments have, either through the regulations that implement the procurement law or directly from the procurement law itself, there's usually a clause that, the criteria for choosing the winner of a tender is based on lowest price only. So they don't allow for any factors on quality, efficacy, supply, compatibility, demand, and all these other things that really add to that value, that value paradigm that's necessary. So one thing that we're trying to do through America's Rise is actually training with both procurement officials, but then also ministries of health, ministries of finance on what does it mean to implement a value-based procurement system? What are the other factors and criteria that you need to have in place when you evaluate a tender proposal, and then looking holistically at what a bidder brings to the table versus just price only, which oftentimes can cost more in the long run if you select only on price and they're not able to actually deliver the product. It becomes problematic, and then you have to purchase 2 or 3 times, and so that actually increases your cost substantially. So that's one very specific example.
Okay, one more questions we have, and this is for Dr. Michael. How are policymakers addressing the disparities in healthcare access and, during the implementation of value-based healthcare? Can you hear me, Dr. Michael?
Hi, I seem to have lost my audio connection. I don't know if you can hear me, but I
Yes.
cannot hear.
Yes. Okay, so we'll take another question for you, Catherine. What metrics are being used to assess the return on investment for healthcare providers transitioning to value-based healthcare?
It's a great question. It's not straightforward either, but I guess that you can look at patient outcomes, right? Like, what did the medicine do what it was supposed to do? If it did, then that's a good investment. If it didn't, then you look at then what is the impact on the patient across multiple different criteria, and then you can design programs that then would reflect that value that was provided to the healthcare system.
Thank you, Catherine. Dr. Reem?
I'd like to come in with maybe just a comment on this really interesting conversation that we're having today. So we're speaking about the policy making aspect with regards to what, Michael, you mentioned about governments and how they're designed and where the decisions are made and the political terms, but also in what Catherine, you're mentioning with regards to this innovative way of contracting for value, and this change is a fundamental change in the relationship between the private sector and the public sector, or the transactional type of relationship that was the classic type of relationship where one party purchases something from another party. And this type of relationship is where everyone comes together to realize a common goal. And with this, even the private sector has to change. The companies are changing their strategies, their approaches, their teams, their capability building. And so this is why we need to have this type of research and these types of sessions for us to learn and iterate and evolve this experience regionally and globally. So I feel very excited about this change, and curious also to see how this will unfold across other regions in the world.
Thank you, Dr. Reem.
Yes, thank you all. Sorry about that technical difficulty, but thank you very much for all of your insights, and for those who've joined us in the chat listening as well for questions. I really appreciate the interest to the study, and I hope you'll take a look at the report overall. I think there was a link somewhere. Maybe we can put that in the chat as well for those watching along now or who watch later. Thank you.
Thank you to all our speakers and to everyone who joined us today. Today's discussion reinforced a central message from the report, that value-based healthcare is not one-size-fits-all model, but a shared vision, one that demands alignment across policy, financing, and also delivery to ensure that every investment in health generate measurable value for people and communities. As highlighted in the report conclusion, Brazil, Mexico, and Argentina each offer valuable lessons. And the Global Innovation Hub is excited to continue this work. Our mission remains to connect research with policy action and to help countries design smarter systems, scale innovation, and deliver value-based healthcare. We will soon be hosting our next webinar in this series, building on today's discussion to explore the next frontier of value-based healthcare reform. And we invite you all to stay engaged through our website, LinkedIn page, and for the updates of our knowledge resources. On behalf of the G20 Global Innovation Hub for Improving Value in Health, thank you again for joining us and for being part of this collective effort to make health system more equitable, resilient, and efficient. Thank you.
Thank you all. Thank you for hosting me. I really appreciate it. Thank you all for watching and participating as well.